Nigeria
is known to have the fourth highest number
of people living with HIV and AIDS in the world,
with about 1.9 million people living with HIV.
Progress has been made in many aspects, especially as it relates to the effectiveness of the multi-sectorial response. However,
the injecting drug use among key populations is still a growing concern.
I inject drugs.
I always feel myself when I inject it.
I started taking drugs.
Are they doing injection?
I take this drug.
Injecting drug use has been reported in every state of Nigeria. Based on available data, the practice contributes about 9% of the annual new HIV infection in the country.
What we are witnessing is the increase of injecting drug use in Nigeria, and in that regards, our facility have reached over 3,000 persons who inject drugs in Nigeria and who are receiving care and support and treatment within the context of HIV and public health services. We have managed them, including STI. It has been shown that it could be easier to contract HIV through sharing of syringe than even sexual intercourse to one blood that is contaminated or a blood who is already infected.
UDRISE Nigeria operates a one-stop shop where comprehensive health services are provided to people who use drugs,
including the provision of antiretroviral
treatment. One of our clients, named Adamu, who recently tested HIV positive, shared his experience.
Now my oga show me that thing, say if I do that, do this kind of thing, she no go allow to anything where he say go pay you for body, she no go hear that one. And just the time where you say I dey doing that thing, I dey using sharing, some more people not dey sharing. And the time where he check my body from Tulokogoma, I see my body no result, no correct result, because of I hear my body say I get HIV for my body. I never stop the sharing with you, but me, why I say I'm not myself, say I'm not feeling fine on my body, now I no go feel using give other person, but even that thing hold me well. If I see am for other person, I go talk and say may you do am, come give me my do it, my blow. But I no want green say me my blow down before I give am may you blonde it, because of that sickness why I get it.
A visit to some injecting locations showed some have their peers inject them and are frequent in sharing
and the reuse of needles.
I started this almost getting to 8 years. I was injecting myself. I see that from my friends, so I asked him what is that. He tell me it is drugs, and I tell him to give me. When he gave me, I test it and I feel it. I was trying my best to stop it. I couldn't do that, and I started sharing it like three years ago, because the thing entered my blood. I couldn't do without it. So if I see my friend or any one of my nigga who have it, I will tell him please do it and remain small for me. That's how I started.
Our team moves to Kano. Kano has been in the news in recent times for drug use. We met Shuaibu from Fawida, who provided an insight into injecting practices in the state.
when you reach Sabangari market, it's just easily to get this pentazocine or ketamine injection. There is one ketamine injection, I think you know ketamine. There is ketamine, there is pentazocine. So ketamine is more powerful than pentazocine. You know, it's all paralevers. You got me, bro? So it's very rampantly. I think so is almost 75% of people that are taking weed and drugs, they are injecting themselves. Before, it's not anybody does not this injection, but gradually, just people they enter like they don't know how the effect is, and the thing is, it's addicted. When you start, it's very hardly to stop.
The team moved to Lagos, and in Lagos, they do not show anything different. Walking through some drug-using communities, one can see used needles and syringes scattered all around.
The issue with harm reduction in Nigeria is very critical because it's supposed to form part of the response to HIV prevention, treatment and care, not just for the key population but for the country, because it has implications for the general population if we have any population that is isolated in the response. Harm reduction in particular, Needle and Syringe Program as well as Opioid Substitution Therapy is overdue in the country because there is still a lot of high-risk behavior among people who use drugs, either because of poor access or lack of affordability for prevention equipment like syringes and needles. Sometimes it's not accessibility or affordability may not even have to do with the actual cost of it. You know, we've had situations where known people who inject drugs are refused access to syringes and needles from pharmaceutical companies and stores. Research has shown that harm reduction, specifically opioid substitution therapy as well as needle and syringe programs, can help to reduce new infection by more than 50%. And that's what we are missing in this country because we've not been able to make significant progress. A lot of discussions have gone ahead in the past and still ongoing at Ministry of Health level, at the National Agency for the Control of AIDS level. There's a lot of engagement with the NDLEA, there's engagement with the Office of the Senate President, there's a lot of discussions going on with engagement of civil society organizations like Youth Rise and others, so many in the country with support of development partners as well as the government of Nigeria. But we've not really made significant progress.
So we are recommending that the government of the country should review the policy and try to see how to implement the Needle Syringe Program. Being public health oriented, Nigeria should be looking at that as a public health issue instead of just punitive law. It's not just about going to bunks, jungles, crack it down, arrest the dealers. Where have they been? How many dealers have they convicted in all those years that they've been arresting? And all the arrests and all the crackdown they've made, has it stopped the transit or the consumption? No. These people are still injecting and there is no accessibility to these things. These things will still be there. They go on the ground to buy it. They make them to run, to hide. You will not see them if you want to reach them some point in time. So instead of chasing them, we are looking at the Needle Syringe Program, and the Opioid Substitution Therapy needs to be urgently introduced within our public health services. And we should understand that this should be managed by social experts.
Injecting drug use is prevalent in Nigeria. There is an urgent need for a comprehensive response that will include the full complement of harm reduction services. Together, we can work towards a country with zero new HIV infections.